Frances, let's talk now about patient protection.
Well, let me begin by saying that all the procedures aimed at reducing radiation fall under the ALARA concept, A-L-A-R-A. This stands for as low as reasonably achievable. And this means that you, the dental assistant, have some control over how much radiation your patient actually receives, which means it should be kept as low as possible. It's your ethical and legal responsibility to adhere to this concept. It's also the dentist's responsibility to prescribe the radiographs only after a clinical examination to make sure they're needed.
But how does the dental assistant accomplish this?
Well, we have some different areas that we have to. The first is that we have to position the patient correctly. And this is extremely important. If you are ever in doubt and you really don't understand how to get a patient in a particular position you need, then you need to consult the dentist or your supervisor and see if you can get some help. Another thing that we use to help us are film holders, like the XCP, Ren XCP holders or the Snap Array. And those help to position the patient correctly. That helps in our positioning so that you get the film and the patient and the machine all lined up together. Another thing that is extremely important is the film speed, how fast the film will be exposed. And currently, the E-speed film is the film speed recommended to use for maximum radiation reduction. Careless selection of exposure factors also contribute to poor radiographs and unnecessary retakes. This can be avoided by choosing KVP and MAS from a technique chart posted near your X-ray unit. When your responsibilities increase to include exposing radiographs, you should learn more about using recommended exposure factors. The second method for decreasing patient exposure and improving the film is proper collimation. Collimation means that the X-ray beam is limited to the area requested by the doctor. Limiting the size of the X-ray beam reduces exposure of the patient, including to the critical organs, such as the reproductive organs, the eye, and the thyroid gland. Most modern dental radiographic machines are designed with collimators that automatically reduce the beam to the size of the film. It's recommended also that the long lead-lined open-ended cones be used on dental machines as opposed to the short plastic pointed cones. The third guideline is to always use shields when radiographing your patient. Leaded aprons and thyroid shields minimize exposure from scatter radiation of the X-ray beam to the critical organs during all radiographic procedures. Special shields which cover the shoulders and the back should be used when taking panoramic radiographs. The aprons should be placed on the patient before the first exposure and left on until the last X-ray film is exposed. The apron should cover the chest, the throat, and reproductive areas of the patient. The aprons should not be stored by folding. Cracks may result from the bending of the lead insert, which might allow radiation to leak through. The lead aprons should be checked for cracks about once every 3 months. And the fourth guideline is to correctly process the film. A successful exposure is only half the battle. Careful attention to processing is equally important. If films are ruined during processing, the patient will require repeat films, thus multiplying his exposure. Keep in mind that more films are ruined during processing than during exposure. Having an automatic processor does not guarantee good results in film processing. Automatic processors demand rigid scheduling for replenishment and replacement of chemicals. Routine preventive maintenance is required in order to produce films of consistent high quality. Frequent cleaning of the rollers is a must to keep your films clean. Replenishment and replacement schedules should be posted and monitored in your darkroom or near your automatic processor. Proper manual processing requires the use of fresh chemicals that are replenished and replaced frequently to assure optimum strength. Films must always be developed using the appropriate time-temperature technique. An unfortunate practice, which has sometimes been used to save processing time, is site development. This is when the film is often overexposed and then developed for a shorter time than recommended. Always avoid site development. It causes unnecessary exposure of the patient and actually reduces film quality. Darkrooms should be kept clean and well organized. Streaks, spots, fog, and other film problems can usually be traced back to poor darkroom conditions.
Are there any other tips about processing that you can give us?
Yes. The safe light should have a white bulb that's no more than 15 watts. And you should check the safe light periodically to make sure it doesn't have scratches in it. Oftentimes you'll find scratches in the red safe light itself. They should be hung at least 4 feet from the surface where you will have your films so that the films don't become fogged.